Welcome everyone to our September edition of Poderosas to the Front. We will be joined by Destiny Lopez, co-director of All Above All, and Alejandra Pablos, activist and WeTestify Storyteller. And I'm Laura De Anda. I'm the senior trainer here at the National Latina Institute for Reproductive Health. Today, our discussion will be about access to reproductive health care past, present, and future. I'm going to ask our panelists to go ahead and introduce themselves before we dive in.
Great. Hi, everyone. My name again is Destiny Lopez. I'm the co-director of All Above All. We are a national campaign that works to lift the bans that deny abortion coverage, like the Hyde Amendment. We'll be talking more about that, so I'll stop there.
Hi, everyone. My name is Alejandra Pablos. I'm a reproductive justice and immigrant rights activist. I'm also a WeTestify Storyteller, a project from the National Abortion Fund Network, and a member of Mi Gente, where I'm fighting my own deportation case right now.
Thank you both so much for taking the time to join this discussion about access to abortion care. And I know that, today is a heavy day given what's happening with the Kavanaugh hearings and folks listening to Ford's testimony. I'd love to hear your thoughts about Kavanaugh, Ford's testimony.
Yeah, this is Destiny. I'm happy to start. So first, I want to say for folks who are maybe going between this conversation and that one, or who might watch this later, it's a hard day to hear that testimony. I think especially, I would imagine, for survivors. So first of all, I want to say to survivors, we believe you. We believe Dr. Blasey Ford. We believe Anita Hill. We believe all of the women that are coming forward. And so I want to make sure folks are taking some self-care. We were just talking about having some tea by our side, some lavender oil, whatever you need to get through this day. But also as Latinx folks, as folks whose families have histories of detainment, incarceration, etc., we know these struggles all too well. And so this might be a hard day or a harder day even for some of us. And so I just want to acknowledge that. And I also want to say that, as a reproductive justice advocate, reproductive justice really includes agency over our bodies. That means that that's free from sexual, from physical, from political violence. And it's especially important to marginalized women of color, to immigrants, transgender folks. And Kavanaugh is a threat to that justice. And so that's why I'm feeling heavy-hearted today. We know that Kavanaugh is going to have a lifetime appointment if he's appointed. That means he could sit on the court for decades. That means that the impact of his decisions and that of the rest of the court will shape the lives of our communities, of our people for generations to come. And so, we know that as a judge, Kavanaugh ruled to block an undocumented minor in government custody from exercising her right to an abortion. Last year, he publicly praised a dissenting opinion on Roe v. Wade, which protects abortion access in part in this country. He's ruled that employers' religious beliefs should be allowed to override employees' access to health insurance coverage of birth control, on and on and on. So we just know from rulings around voting rights to rulings around fair wages and unions to rulings around abortion access, we know that he is not going to be good for our communities. And if he's appointed, not only will we have a sexual abuser on the Supreme Court to join the other that we know is there, but it will really turn against the rights and lives of women of color and of our communities for generations.
Thank you so much for that answer, Destiny. And I think we were having some technical issues. I'm sure Alejandra will join us as soon as she's able to. And I think it's really important to uplift everything that you just said about just self-care, understanding how triggering this can be for so many of us. Survivorship is real and being believed matters. And then uplifting that Dr. Ford's testimony and how she's elevating so many stories, right? Mm-hmm. When she's telling us hers, she's also embodying all the stories that we can't hear.
That's right.
And I think one of the things that comes to mind for me in having to bear witness to this again is, as you mentioned earlier, Anita Hill and what she had to live through, and again, embodying so much for so many. And then the burden that we have as Latinx people to uplift our stories over and over again. It's like, how many of us do we have to show you the scars of and the raw wounds of before we're being believed? And I mean, a particular story comes to mind for me, and that's the story of Rosie Jimenez. And I don't know, Destiny, would you share a little bit about the story of Rosie Jimenez?
Yeah, definitely. So the work that I do at All Above All is really focused on lifting abortion coverage bans like the Hyde Amendment. And essentially the Hyde Amendment prevents low-income women who are qualified and enrolled in Medicaid, which is a government health insurance program, from accessing abortion care, right? And so it happened over 40 years ago. It's something that Congress votes on annually. They can get rid of it any time. And it really started with one woman's story. And that's the story, as you said, of Rosie Jimenez. Rosie was a young working class Chicana from McAllen, Texas. She was a mother. She was a college student. She was 6 months away from graduating with a teaching credential when she realized she was pregnant. This was in 1977, so it was just a few months after the Hyde Amendment went into effect. Rosie visited a doctor in her hometown to try to get an abortion procedure, but the practitioner would not serve her because the Medicaid no longer covered or reimbursed that provider for abortion care. And so she was desperate, right? And she had very little cash. So she made a decision for the best, for what was best for her and for her family, to cross the border into Mexico, where she obtained what was then an unsafe, illegal abortion that eventually led to her death. And so we often remember Rosie on the occasion of the anniversary of the Hyde Amendment because she was the first death. And so not only was she the first death, but she was obviously a young Latina woman. And so I think for the Latinx community, it's incredibly important to bear witness to her memory at this time every year, and to understand the real world impact that policies like Hyde have, but also to put it back into your context, that these kinds of nominations to the court have on real people's lives.
That's right. And how it's compacted over time, right? If I have here a quote from Henry Hyde, right? He said, "I certainly would like to prevent, if I could legally, anybody having an abortion, a rich woman, a middle-class woman, or a poor woman. Unfortunately, the only vehicle available is the Medicaid bill." And when we talk about it being the Medicaid bill, who is he impacting the most?
Poor people, women of color, young people, immigrants. I mean, all the communities that I know the Latina Institute cares about, that I know we are all a part of. Those are our communities, and those are the ones most impacted. Absolutely.
And then bringing it back to like the quotes of Kavanaugh during his testimony or during the hearings, where he said he referred to birth control as abortion-inducing drugs, right? And what does that tell us?
I mean, right. I mean, it tells us his worldview, right? Like if we didn't know it from, the cases he's actually ruled on, if we didn't know it from kind of that piece, if we don't know it from all of these accusations that are coming out now, we know that he doesn't value women, that he doesn't value facts or science, that he doesn't value the immigrant experience. I mean, we can point to all of this, and it's telling us that, that he's not the right person for this court.
Can you guys hear me?
Yeah.
Yes.
Hey, so I think it's definitely going to be tough for all of us if Kavanaugh is confirmed, and uplifting everything you guys said. I've been spending the morning listening to the questioning of the doctor, and it's just really unfortunate that she has to go through this. We definitely don't want to repeat another Anita Hill experience. But if he's confirmed, I mean, and along other justices on the Supreme Court who are known as sexual abusers, and they decide to reverse Roe v. Wade and make abortion illegal again. I mean, but let's talk about what illegal really means, right? If Roe is overturned, abortion will be illegal and inaccessible in some states. That doesn't mean it's unsafe. It just means that in one state you can take a simple pill, have a safe abortion, and not be prosecuted. But in another state, you do this exact same thing and you'll be criminalized and go to jail. You'll go to jail just getting healthcare, And this is where I think it deeply intersects with the criminalization of Black and brown bodies. Because we know who will be prosecuted. We know some people will just skate free. And it's just like my own immigration case, right? In some states, being me is okay. In like Arizona, I can be deported for just being me. So it's a patchwork of laws that is really dangerous for our communities. And it keeps people afraid of the cops, because we're never quite sure if today is the day that I'll be jailed, picked up, killed, or prosecuted for something that's basic and a human right all around the world. So the right to move freely, access healthcare, and deciding our future is on the line right now. Deciding if and when and how to grow our families is on the line if Kavanaugh gets confirmed.
Yep. Yeah.
Absolutely. Thank you so much for uplifting that, Alejandra. And we also had the opportunity to discuss the different stories that need to be uplifted. And I think your personal narrative and the struggle that you live through, and how powerful you are como una poderosa in terms of staying strong and choosing to speak out against these injustices. When you think about the story of Rosie Jimenez, and how Hyde impacted her, and the struggles that you face in terms of having access to healthcare, reproductive healthcare. What can you share about that? What comes to mind when you think about Rosie Jimenez?
I mean, the consequences of not having access to reproductive healthcare. You know, those consequences of not having access, like untreated STDs, cervical cancer, unhealthy pregnancies, even death. Folks are out here dying because they don't even have access to good prenatal care or healthy pregnancies, especially Black folks, Black Latinx. Same for cervical cancer, right? Which is the #1 threat for Latinas. Sometimes folks have to get abortions, and when they do, they can't get safe care, either in a clinic or by ordering pills online or by herbs, whatever it is, right? So they use an unsafe method, and that can lead to complications or fatalities. But we can prevent death. We could have saved Rosie Jimenez. And yeah, like you guys uplifted, she was a mom. She was going to college. And this was right after Congress started banning Medicaid from covering abortions. So she went into Mexico for this unsafe care and later died. I think about Rosie every day. We must carry her memory with us and think about how we do this work so that we don't have to bury more of our families.
Mm-hmm. Yeah, I would add one thing too. I mean, for me, I was born 2 years after the Hyde Amendment. So this could have been my mother, right? Like, I'm a Mexican, second generation Mexican American. My mother, while she didn't have another child, she was in school when she gave birth to me, right? Like there is very little that was separating Rosie Jimenez from my mother. And so, that's why I do this work. And that's why I work on abortion coverage issues, because I don't want this to continue to happen to our communities. I feel lucky and grateful that we have, that the medicine has come so far, right? Like our people, in Latin American countries have been doing this for a long time, right? They know how to take pills and do this, on their own if they need to. But I think one of the pieces of this work that we also need to continue to do is to let folks know about things like the medication abortion pill, right? So they have access to it. So they're not, we can prevent these deaths. And so making sure people understand and know what their options are, which means that we have to make sure for our communities, right, that we are providing services in language, that it's, it resonates with us culturally, that we're able to get it regardless of our immigration status. So I just feel like Rosie's story for me, like both envelops a lot of feeling around my own family, but also just exemplifies, what's missing or the barriers that folks still have to face to access this care.
Absolutely. Thank you so much for that. And in terms of, again, connecting to the power of our stories and these individual stories that we use to represent so many. I mean, Alejandra, I think it was really powerful when you said that we need to stop burying our family members, right? Like, a nuestra gente, like who is most affected by these policies? If Brett Kavanaugh is nominated, Hyde gets renewed every year. Like, how many nameless victims are represented by Rosie Jimenez? How many nameless victims are represented by Dr. Ford? Right. And then how is it that in your work that you push back against using all the spirit of all those people that we know are embodied in these specific narratives? How is it that in your individual work that you push against that? How are we fighting back in your individual stories?
Ale, do you want to start?
Yeah, I can start. Thank you. So yeah, I think that's a very important question. And I think that's something that a lot of people are always asking me, especially like you uplifted, being out on the front lines, going in and out of an immigration detention center, and just fighting for my freedom, right? Fighting to figure out a permanent protection for myself, since there is no status I can apply for. There is no documentation that I can apply for. So literally, so like you said, bringing the spirits of all of our future generations, right, our young people right now, we can ensure that our future generations have access to reproductive health care, that they have context to, like, when they're organizing, but literally keep doing what we're doing, and by having these conversations, by having this place, this webinar, right, by having community cafecitos, by organizing your own family, by what we're already doing, we're getting stronger. That's the thing that they don't know, is their attacks against us are just escalating. Our organizing is also escalating, right? Our unity, our Black and brown relationships, like, we're figuring that out, you know? So I think organizing, sharing our stories, funding abortion for loved ones in your neighborhood, figuring out who those folks are that are supporting the women and the families, supporting WeTestify, right? And storytellers like us that are really at the intersections and really trying to push the narrative, so we can all, like, live in those just and liberated worlds. But and fighting alongside survivors, right, of dangerous reproductive health care process, because like you said, all of us are under this umbrella of who's getting attacked. So we need to talk more to our jóvenes too, to our young people. Our young people feel when there's chaos around us. They understand. So we got to treat our young people like adultos, you know, and, like, give them that respect, share that information that we know. So even talking to our boys and girls, our gender non-conforming kids, about consent, what their options are, why it's good to have safe sex, all of those things matter. And we can't be afraid to talk about anything right now, because you know what? They're not afraid. They're not afraid. They shock us every day, right? So, I mean, I want to be known and trusted in our neighborhoods for always keeping it real, and always also not just keeping it real, right, but also providing the tools for us to fight back. So we need to have these conversations. We need to have them now, and not just with the future generations, but entre familias, in inglés, in español, in whatever language. We got to figure it out. And we got to talk to our abuelas too, with that intergenerational, right? So breaking that cycle, and we have we already have, and we can't have the lessons that we've been taught, and that we are unlearning being taught again, right? It's like doing all the work for nothing. So we got to make sure that we are supporting campaigns also, right? Like, thank you, Destiny, for all the work you're doing with the Above All. I know when I was organizing with the Latina Institute as well, you guys were really big partners, and actually gave me a lot of comprehensive data to be sharing with our communities, right? We talked about the Each Woman Act, something that would actually end the ban on Medicaid, right? Coverage, things I didn't know nothing about before. But for real, we need to abolish ICE also, right? We criminalize abortion, right? We need to make sure that our bodies can actually thrive within these borders without fear and repercussion. And that's how we do it, by supporting each other, letting each other know that we got you, even though everything seems like is failing around us, right? Like, we are here, we got you.
Yeah. Yeah. I mean, what Ale said, and then I'll add a few more things. I mean, I think having these conversations within our family, I mean, today, again, with this testimony around sexual violence, I mean, I think we have, you know, I only recently learned about the history of sexual violence in my family, because we didn't have these conversations growing up. Like, we barely talked about sex, certainly not about abortion, like, right. So I think having these conversations with our families within our communities are so important. I think as important, if not more important, is listening. We have to listen to people like Ale and the other WeTestify abortion storytellers who have had abortions. We have to listen to people who are experiencing barriers or access to reproductive health care, who are experiencing barriers because of the borders in our country, right? We have to listen to people's stories and help that inform our work. And then we have to act in the ways that we can, right? And so if you can call your legislator when our lives are at stake, you got to do it. It's a pain in the ass, but it's easy. You make a call, you say something, you know, all of these organizations provide scripts for this kind of stuff, but it's so important that they hear from us. If we can, we have to vote. And if we can't vote, we got to talk to the people who can vote and tell them how we feel and what's important to us and who we need to vote for to ensure that our communities and our families' bodies are protected and that we can access this care. You know, I think that for us, what that looks like, it does look like organizing, right? So we organize young folks, we organize people of color. We're right now on the doors in Nevada, knocking on doors, talking to people about abortion coverage and about the intersection with economic justice and fair wages. and there's only a handful of us doing this around the country, but we have to have these public conversations with people in order for them to understand where we're coming from, and in order for them to support us through their vote or through their calling or whatever way they can do that. And then this weekend, we're doing this event called Bold Ignited, where people around the country are going to raise the visibility of abortion coverage bans and abortion access through fun things like glow in the dark necklaces, and they're doing like a fish fry to hide fish fry, like all kinds of crazy things, because we also have to have joy in all of this too, right? Like today is we got to make it sexy and joy, right? So I mean, today is a heavy day, but we have to find light in this too, and that's really what Bold Ignited is for us.
Yeah, and it just occurred to me right now too. I know that a lot of folks, with this new public charge situation happening too, right? Like this is once again talking about healthcare, talking about people, the small percentage of people really who actually have Medicaid or are getting some sort of assistance are now backing away from that, right?
I'm going to interrupt you for 1 second. I'd like, can you define what public charge is for our audience, and then explain how that's an attack, please?
Yeah, sorry. So just really quickly, so public charge is just kind of like, I mean, it happens in very different ways, actually. Right now, there's a public charge, particularly talking about folks who are getting public aid, right? So you're applying for anything like Medicaid, food stamps, anything that is charging, right? Like you as the public are charging the government, right? Yeah, so right now they're using that against basically talking about immigrant folks, right? Like people who are maybe possibly on a pathway to some sort of documentation or citizenship, which we have those families. We have a young activist actually from the Virginia Latina Advocacy Network right now who has no status herself, but her parents are actually gaining citizenship through another relief, and her little brothers, one of them has epilepsy and they're on Medicaid, but because of this new public charge threat, her family is really aware of the consequences, right, of their future. So they're now backing away from Medicaid, right? So this is actually happening right now. We're talking about how our families need to get access and healthcare and how we're reaching them. But what about they're being forced, right? They're being forced to actually say goodbye to whatever healthcare they actually did have, the little help that the government was giving them, right? Which is also our right. Like we are actually paying for this, right? Like our community, I'm okay with paying for this stuff, right? I'm not okay with paying for guns and more policing and more cops in our schools, right? So it's like, I just think it's just like a vicious cycle. And yeah, by organizing, by talking, educating ourselves, by providing ways for our folks, like, to really be able to access this healthcare is important. And so we have to also stand up for this public charge. And if you guys can add a little bit more, that would be great too.
No, you did a great job.
Okay, great.
Yes, thank you so much for that. And I think I think these things come to mind because we're thinking about abortion access, we're thinking about abortion care, and we're thinking about our communities and how we are being attacked. And I have to thank you both so much for uplifting how we're fighting back in your own work, and also explaining to our audience that there's action that you can take immediately with the examples that you all gave. Let's have conversations with everyone from every generation, the young, our colleagues, the old, like everyone needs to be in on this conversation because it affects all of us, right? And let's be aware of what the attacks are and what they mean. They use these terms like public charge or terms like the Hyde Amendment. If you as our audience are unaware of those things, I'm glad that we could introduce those things to you, and you can Google them, or you can reach out to us, and you can have conversations with us individually. You can tweet at us, as you can see underneath the blurb. We're here for that dialogue. We're here for you. As a Latinx community, we do need to stick together, and we need to stand up together. Those of you that know less, please stand up and have conversations with us. That's what these talks are for. I feel so inspired and so privileged to have moderated this conversation with both y'all. I think you both are such amazing poderosas in the work that you do. And it reminds me, and I hope it reminds everyone in our audience, that nosotras también somos poderosas. Si tú estás en tu casa y no te sientes poderosa, sí lo eres. Porque tienes estas hermanas aquí, hermanex aquí. You have us. If you don't feel empowered, it's because the attacks want you to feel that way. You need to feel empowered in gaining more knowledge and taking action. Having a conversation with a loved one is enough.
Squad up, y'all. This is a This is a place for you to get together, whether it's Bolt, whether it's the NLIRH squad, right? Whether it's whoever it is, find a squad that's going to support you. Surround yourself with people that are working on liberation, and a just world with a clear vision. So you got to squad up. Do not get left behind.
And if you feel left behind, tweet at us. We're here for you.
Gotcha.
Yes.
We are here for
Not
you.
the greatest sentence, but yes.
We have, our organizations have actions for you. We have things for you to do. But you can also decide on your own what you want to do and take action and tell us all about it. This is a dialogue and you're included in it. So please subscribe and tweet at us and join us for the next Poderosa gathering next month, which will be here at this channel. Again, thank you so much to Alejandra, Pablos, and Destiny Lopez for your time and wonderful inspiration. We are so grateful that you have participated with us here at the National Latina Institute for Reproductive Health.